Greetings to everyone. The topic of our video today pertains to the alarming link between a chemical in everyday plastics and heart disease deaths worldwide. In 2018, di2-ethylhexyl phthalate, or DEHP, a plastic softening additive, was tied to 356,238 cardiovascular deaths, with regions like South Asia and the Middle East bearing the heaviest burden. This global health crisis, costing up to $3.74 trillion, demands urgent regulatory action to curb exposure, especially in rapidly industrializing nations. Without further delay, let us delve into our discussion. Heart disease, a relentless global killer, finds an insidious ally in a chemical woven into the plastics we touch daily. Could the very materials shaping our modern lives, food containers, medical devices, even cosmetics, be stealing years from our hearts? A groundbreaking study, published online April 29th in Lancet eBiomedicine, reveals a staggering truth. In 2018, 356,238 deaths from cardiovascular disease were linked to di2-ethylhexyl phthalate, or DEHP, a plastic softening agent. That's over 13% of heart-related deaths among those aged 55 to 64 worldwide. The economic toll? A crushing $510 billion, potentially soaring to $3.74 trillion. Imagine the weight of such loss. Not just in lives, but in resources drained from societies. The study, spearheaded by NYU Langone Health, paints a vivid picture of DEHP's reach, with East Asia and the Pacific shouldering 32% of these deaths, and the Middle East and South Asia carrying a hefty 42%. India alone mourned 103,587 lives, followed by China and Indonesia, their numbers swollen by unchecked plastic production. Why do these regions suffer most? Rapid industrialization, coupled with lax regulations, floods their environments with DEHP. Unlike Europe or the USA, where exposure levels are lower, countries like India face a deluge of this toxin, seeping into bodies through microscopic particles. These fragments, born from plastics in everything from bug repellents to plastic pipes, ignite inflammation in heart arteries, a slow burn toward heart attack or stroke. Phthalates, like DEHP, are a silent menace to human health, amplifying the world's leading cause of death, declares Sarah Hyman, BS, the study's lead author and an associate research scientist at NYU Grossman School of Medicine. Her words echo through the data, drawn from 200 countries and territories, with urine samples revealing DEHP's breakdown products in populations worldwide. The Institute for Health Metrics and Evaluation provided mortality data, grounding this first-of-its-kind global estimate of DEHP's cardiovascular toll. Yet the disparity is stark. Why such a gap? Larger populations and looser manufacturing controls in Asia create a perfect storm. Even when adjusted for population size, India's 103,846,506 people aged 55 to 64 suffered 70% more DEHP-linked deaths than China's 157,232,453 in the same age group. This isn't the first warning. A 2021 study by the same team tied phthalates to 50,200 premature deaths annually in older Americans, mostly from heart disease. Now, the global lens sharpens the urgency. Leonardo Trasande, MD, MPP, the study's senior author, and Jim G. Hendrick, MD, professor of pediatrics at NYU Grossman School of Medicine, demands action. Our results cry out for global regulations to shield the most vulnerable regions from these toxins, especially where plastic consumption surges unchecked. DEHP's dangers aren't new. For decades, science has traced phthalates, found in detergents, solvents, even medical equipment, to obesity, diabetes, infertility, and cancer. These chemicals, when broken down, infiltrate our systems, sparking metabolic chaos and oxidative stress. Yet, this study, funded by the National Institutes of Health, Grant PUCS 033423 and Beyond Petrochemicals, doesn't claim DEHP alone causes heart disease. Other phthalates, unstudied here, likely inflate the true death toll, as do risks to other age groups. What's next? The team, led by Trasande, also director of NYU's Division of Environmental Pediatrics, plans to track how curbing phthalate exposure could lower global mortality. They'll probe other health threats like preterm birth tied to these chemicals. But caution lingers. This analysis, while robust, leans on a single US study for its exposure risk link, and individual factors like socioeconomic stress could skew results. Still, the call is clear. Regions drowning in plastic production, Asia and Africa especially, face a disproportionate burden. With 10.473 million years of life lost globally to DEHP in 2018, the stakes couldn't be higher. Will we act to stem this toxic tide, or let it erode our health further? The data, harmonized from diverse global sources, urges us toward change. To support our channel's growth and ensure broader awareness, kindly hit the like, share, and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.